Hi, I'm Vera Arceo. I'm a retired marketing and communications practitioner, and I'm 64 years old. 3 months ago, I came to Dr. Contessa to consult with her about my sagging jawline and my mid-face, and I underwent a thread lifting procedure. It is minimally invasive with no downtime, and she used Enfix thread from Enfinders for my mid-face, and for my lower face, she used the spiral cog. And as you can see, the only telltale signs that I am 64 are my gray hair, if I may say so. So I'm back after 3 months because Dr. Contessa noticed that I have several sagging and lines here, and also my brows, the upper part of my brows, which is my forehead actually, have deep lines already because of my predisposition to my mannerisms, that I am compensating the lifting of my eye by lifting my eyebrows, and so it's creating deeper creases on my forehead. We'll see what's going to happen after the procedure because, as we very well know, thread lift shows instant results immediately after the procedure. Don't forget to subscribe and click the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we will be demonstrating peri-orbital rejuvenation method, making use of our PDO threads. Let's all welcome back Ma'am Vera.
Hi, I'm Vera Arceo. I'm 64 years old.
Talagang she said she's 64 already.
Oh, yes.
Okay, so in the past, we did the so-called mid-face lifting and lower third face lifting for Ma'am Vera, making use of our Enfix threads and spiral cog threads. So let's ask Ma'am Vera, how was the experience?
Well, it was almost painless.
Yes,
So to
okay.
speak. And the results were immediate. Immediately after the procedure, you could see the results. And now it's 3 months since I've been here when Dr. Contessa did my lower and my mid-face. And now she's going to do my upper.
Yes, so last time I already mentioned about that we will be doing upper third treatment. So when it comes to the upper third, we're speaking about the peri-orbital region around the eye area, because I was noticing already the sagginess or the droopy area here of the brow and the upper eyelid. And of course on the forehead region, as you can notice, appearance of these fine lines already. And in the forehead region, this part here, there's volume loss. So actually we have the forehead or frontal prominence here. Below that, there's beginning volume loss already. And there's already appearance of the lines. And also here, the frown line. And then when we go to the temple region, beginning volume loss also, causing the droopiness of the brow and the upper eyelid. And then the lateral canthus of the eyes, they start to go down too. And when we go into the infraorbital region, the skin is beginning to be thinner here. So there's a poor snap test already. Ideally, it should return faster to the original position. And for today, we'll still further do a so-called nasolabial lift, making use of, it's not the cog thread, but we will use scaffold threads. Okay, so we will be making use of our PDO threads. They're minimally invasive techniques, and we wanted Ma'am Vera to look not 64. What's the goal?
63.
60 or a lot younger, 10 years younger. Now, considering we did already like Enfix and cog threads, we are explaining before that in 12 weeks time, they will have an effect of neocollagenesis or skin tightening and skin firming effect. Actually, I'm appreciating a good texture, plus the skin is tighter already right now, and it's just 3 months, you'll still see more results. And now we're doing the upper third, so we'll be showing the procedure when CSA Medical Aesthetics return. We're back, everyone. So we're doing the so-called peri-orbital rejuvenation for Ma'am Vera. We're working on the upper third of the face. So when you say upper third of the face, from the hairline region to the to this inferior brow region, okay, and mid face is from this part up to the part here, and then that's the lower third of the face. So we're working on the upper third. And the goal for Ma'am Vera is to do a lifting of the brow area as well as the upper eyelid. Okay? Because I noticed with Ma'am Vera, she has this compensatory action of lifting her eyebrows and her upper eyelids. Right, Ma'am Vera? She's in 60s, so ideally when we have clients like this, we don't want to do much of the Botox injections of the frontalis muscles, because the more that you weaken the muscle, the more it's gonna become droopy here. It's the frontalis that you're working, or rather that's acting to lift your upper eyelid and your brow area. Okay? Right, Ma'am Vera? So the technique that we will do today for lifting is making use of our spiral cog threads. Okay, 60mm length. My approach will be, I'll be having an entry point. So if I want to lift my center section of the forehead, so like if you want to do your assessment, where will be the strongest point of lift? So where will I anchor my threads? So this is the area where I want to do my entry point. So I'll mark it here, and with a fanning technique, so like I'll have this linear thread here and in the center, and then on this side here. So we'll be doing this lifting for the middle brow section. And then if we want to improve the arch area also, so I'll lift this part here. This will be my entry point here, and make another fanning technique there. Okay. So in terms of our anatomy, what we have to avoid here will be the supraorbital vessels here and nerve. Okay, just palpate for that notch or foramen here. So it's over here. So actually we have to avoid that part there. And like medial to that, 1 cm is your supratrochlear vasculatures and nerve. So you wanted to also avoid that region. Same thing here, palpate. So there's the notch. So I wanted to avoid that. And then medial to that will be your supratrochlear. So those are areas you have to be concerned about. And then also look for sentinel veins here. So you have to avoid those veins also when you insert your threads. So this part here, I have this vein here, so I'll be avoiding that. I'll be working on this part here. So entry point here, and make your, so I'll avoid this. I'll go between and then make a straight line here, and then this part here. So that's how I will lift the middle brow as well as the arch. Now when it comes to the tail of the eyebrow, I can do a so-called reverse technique. My entry point will be here, here, and here. So it's just gonna be a diagonal line here, diagonal line there, diagonal line there. So in our temple, we have to be careful with our superficial temporal artery here, plus branch of the facial nerve here. So the anatomical plane, that will be the one that we have to also discuss, which is the right anatomical plane where you insert your threads. So same thing here, I'll be using this as my entry point, and then diagonal vector here. So the goal again is to lift the tissues here towards the temple area here. So that's for the upper third region. Now, I'll be also combining the upper mid-face part of Ma'am Vera here. So there's a concern of the under eye skin here. It is already, there you go, it's loose, Ma'am Vera. So poor, like when we do snap tests, so there's still that pinch skin. So we have to restore the skin's elasticity, tightness, and firmness. So I can make use of my DermaSpring threads. My entry point will be from the lateral canthus, like half cm. If I'm gonna do my measurement there, that's 5 millimeter. So that's gonna be my entry point. And then I can do a single entry point here, and then just a fanning technique here. There you go. Same thing on the other side. So taking a look at the lateral canthus, you have narrow eyes. And then same thing, like a 0.5 cm or 5 millimeter inferior to that. And then we're gonna do our entry point here. Okay. So we'll be doing also DermaSpring threads here. And then we also wanted to correct the nasojugal groove as well as the tear trough deformity. We can make use of our scaffold thread. Our entry point will be, if you draw a 1.5 cm from your lateral canthus, and then 1 cm below that. Then this is our entry point. So this is just markings for our entry points of our scaffold there. Okay, so same thing on the other side. So 1.5 centimeter, and then 1 cm inferior to that for our scaffold. Okay, how are you feeling, Ma'am Vera? Excited. So I'm just gonna mark again the part here. We have the supraorbital and then supratrochlear. Supraorbital, supratrochlear. So those are like markings for your blood vessels. And infraorbitally, like if we want to locate for the infraorbital foramen, mid-pupillary, we measure like 10 millimeter from the orbital rim. Okay, mid-pupillary. There you go. So this is now the infraorbital part here, which is also like a concern for doctors, something you have to be very careful with whenever you do your mid-face treatment. So palpate for the lower orbital rim and mid-pupillary. Okay, but this will be on a very deep anatomical plane. So that's gonna be our treatment for the upper third and a portion of the mid-face section. The actual demonstration for our brow lifting using our PDO threads, I have here Pain Freeze here, a spray, our anesthetic here. So we wait for it to, is it very cold? And then I can still inject my lidocaine. Okay, yeah. And we'll be injecting the track of the thread. So I still have the marking there. So up to the orbital retaining ligament here. Ma'am Vera, you still good, right? Yeah, it's still cold, very cold.
Still cold.
So probably about a minute, it's still gonna be very cold, or 5 minutes. You can time it. Let me know, Ma'am Vera, if you're still okay. So combining the Pain Freeze and our lidocaine injectable. So I'll make an entry point. So disinfect, please. And then your sterile OS. Thank you. So entry point there. Okay, and then pull. So my first spiral cog thread towards the center. So this one will also improve the frown line. So I see this deep furrow of Ma'am Vera here. So we're gonna correct that too and then pull out. And then we will lift. And then pull it. There you go. You can see the lifting of the spiral 60 millimeter cog thread here, and cut. entry point. So you can see a frosting there. Very cold, Ma'am Vera. Okay. And we will inject our lidocaine at the entry point. So I'll be lifting the arch of the right eyebrow. So here's my entry point. Okay. Whenever we do procedures like this, we advise our clients to avoid intake of, for example, vitamin E, fish oils, ginkgo biloba, and also the blood thinners, so we don't have problems of bleeding and easy bruisability. So for our clients who will undergo this, those are things that you have to avoid before you do a procedure like this. Okay. Now for the case of Ma'am Vera, I have a vein here in the center, so I'll avoid that. We don't want to induce too much or cause hematoma there. Okay. So I'll be working on the right side first, and we'll look at the effect left and right later on. Now I'll combine with the so-called fax eye thread lift technique. Okay, my entry point will be at the corner of the eye and the tail of the brow. Okay, so spray the paint freeze at the entry point. So you can see the frosting there, and then make your injection of your lidocaine. Lidocaine here. And then we'll also further numb the area via injecting the thread track. Okay, so we'll have 3 entry points for the corner of the eyebrow or tail of the brow, and then 0.5 cm inferior to that, and another 0.5 cm. So 3 entry points, and then so this time it's gonna be a reverse method. Instead of having entry points near the hairline, our entry point will be at the directly here, skin part area, okay, up to the scalp area. That's first, and then here. So I'm using spiral cog thread 60 millimeter. Pull like that, and when we cut, like push onto the skin and cut. There you go. So we've done the right forehead temple region. Okay, so we'll proceed with the under eye area. So again, we're using the paint freeze, so there's a frosting there, and I'll numb the entry point with my lidocaine injection. So just a minimal amount there, and there you go. So this is our entry point, and we'll make use of a gauge 21 and puncture. And so we have the derma spring thread here. This is a gauge 29 40 millimeter. Okay, so it's a derma spring, and glide towards the medial canthus area. So we wanted to reach the tear trough region too. So I'll be using 5 derma spring for the right side here, and going towards the tear trough area. And you can actually push the skin opposite to your vector, so that there'll be a good support also. Now I'll proceed to the so-called scaffold threads. The goal is to correct the nasojugal groove here, as well as the nasolabial fold there. And if you want to recontour or like restore the nice cheek OG curve there, you can make use of the scaffold. The scaffold is also a very good volumizing thread. So for those who don't want to use dermal filler, you can make use of the scaffold. So I'll make an entry point. So you can have like a 1.5 cm and then 1 cm beneath that, and that's gonna be your entry point. So just a tiny needle injection, and we'll puncture for our entry. And then I'll use this braided scaffold PDO threads. It's gauge 21 and 60 millimeter length, and towards the here towards the nasojugal and nasolabial fold. We can also correct the tear trough by placing 1 to 2 strands there. It's like following the orbital retaining ligament area there, and you have to really reach the opposite end and then pull out with the twisting technique. And the good thing with these threads, in terms of their duration of effect, they could last longer compared to our hyaluronic dermal fillers. So we've done right side, so our spiral cog threads for brow lifting, spiral cog threads for the fox eye lift, derma spring for the infraorbital or under eye skin, and the scaffold to treat also the infraorbital region. So we'll proceed to the left side. So we have done the periorbital rejuvenation, making use of our PDO strands of threads, and we'll show the result to Ma'am Vera when CSA Medical Aesthetics returns. So we're back. We have done the periorbital rejuvenation for Ma'am Vera and a little bit in the infraorbital region. So we'll show the result to Ma'am Vera. So we have our mirror. So she can check on the forehead region, temple region, and the below the eye region, plus infraorbital area. So actually, again, we have made use of our spiral cog threads on the forehead area as well as the temple region to lift the brow section. At the same time, we use derma spring threads under the eye, plus scaffold threads for the mid-face region to also correct nasojugal groove and nasolabial fold. So, Ma'am Vera, how was your experience?
Well, like I said in the beginning, the results are immediate.
Yep.
After the procedure, you will see the difference. There's a slight discomfort. Doctora, can I wash my face?
Yeah, after this, okay, actually we did already cleansing before the procedure. So we tell our patients to wash their face the following day and use only cold water, so avoid anything that's so hot. And then also, you can also cleanse the area with the entry points, so you can make use of your disinfectants like your alcohol or even your betadine, just to disinfect those injection point areas. So far, Ma'am Vera, okay, we really expect some swelling there because we did multiple needle injections, and particularly on the under eye, around the eye area, because in the under eye region, we have multiple palpebral vessels. Ayan, okay? So, for that kind of swelling, we will recommend some anti-inflammatory, anti-swelling medications. You can apply your arnica gel or vitamin K cream, and also take some anti-swelling and prophylaxis antibacterial, and we'll also prescribe some tranexamic later on. And then we will be giving you like do's and don'ts, and of course avoid strenuous activities, and the types of food to eat. Of course, avoid anything that's gonna aggravate the swelling of the soft tissues. So we were able to achieve like an overall face rejuvenation treatment for Vera. We have just completed the initial ones we've done, the mid face and the lower face, and a little bit of the upper neck area before, and right now we were able to do the upper third, and then we will still do beautification and further enhancement, like for example the center part of our face, whereby we will also do non-surgical techniques. For example, the center of attraction, the nose, we can still do nose augmentation, nose lifting, and some procedures that we can still do around the mouth to prevent some of the lip lines. And still, I will like do a follow-up of the upper third, probably in the next treatments. We can still do like skin tightening and lifting on the sides of the, like for example, corner of the eyes. Because for her case, I still see some crow's feet there. And if we don't want to use toxin or Botox to target the crow's feet, we can make use of our derma threads to correct that already. Okay, are there any more questions or concerns, Ma'am Vera?
Oh, well, the only concern I have is, when am I coming back?
Okay, that's the wonderful thing. Okay, so our clients, okay, as much as possible, whenever we do them, we reduce the pain, we make them feel comfortable. And when they have experienced the treatment already and they realize, oh, it's just like this, it's tolerable, it's okay, and just the effect is I'm becoming younger and more beautiful, okay? And of course, it's helpful in your confidence, in your self-esteem, that even if your age is already in the 60s, you feel like you're just in your 40s, okay? So, like 20 years younger. We have to do something to take good care of our face, of our skin, okay? And this is one way to be able to help yourself, loving yourself too. It's the so-called self-care and self-love. Okay, sino ba bang magmamahal sa sarili natin? Of course, first and foremost, tayo, sarili natin.
Yes.
Okay, so we'll still do another follow-up for Ma'am Vera. We will still do series of rejuvenation, maintenance of rejuvenation, and further enhancement, highlighting the beautiful parts of the face of Ma'am Vera. Thank you.
Thank you, CSA. Thank you, Dr. Contessa.
Yeah.
And I'll be back.
Okay, we'll see her again. So thank you so much. If you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. For those who have missed the episodes, the previous procedures we have done for Vera, you can just check our YouTube channel, Contessa Salvador. Okay, thank you, Vera.
Thank you.
Thank you. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.